Hello, my name is Christy Franklin, and I'm going to talk to you about the influenza vaccine. Many healthcare workers are not knowledgeable about the safety and importance of the influenza vaccine. In a study by Broughton, about one-half of the healthcare workers don't agree with the statement that vaccinations are safe and effective. Healthcare workers should be educated on the benefits to screen and encourage those who meet the vaccination requirements. In the United States, 5 to 20% of Americans get the flu each year. Of those people, 200,000 people are hospitalized. Anywhere between 3,000 and 49,000 deaths occur because of the flu. In 2012 and 2013, there were 135 million vaccinations made. Some facts about the flu is that the flu is a respiratory virus. It can be mild, severe, or even cause death. It affects the nose, the throat, and the lungs. Signs and symptoms of the flu are fever, cough, sore throat, runny nose, stuffiness, body aches, headaches, and fatigue. How is the flu spread? The flu is spread by droplets, which means someone either coughs or talks and their droplets land on you. In less cases, the droplets are on a surface and you catch the flu that way. How is someone contagious? It may pass from someone before they even know it. As early as one day before the symptoms show, you can be exposed to the flu. Up to 5 to 7 days after someone has the flu, you can also still catch the flu from that person. Complications from the flu include ear infection, bacterial pneumonia, sinus infection, dehydration, and worsening of chronic diseases such as congestive heart failure or asthma. People who are at risk to get the flu are children younger than 5 years, especially those 2 years or younger, adults over the age of 65, pregnant women, and people with chronic medical illnesses such as asthma, chronic lung problems, heart disease, etc. The next question is, when do you get vaccinated? The flu vaccine, or the flu season, actually runs between October and May, and you can get vaccinated as early as September through May. The peak season for the flu is January to February. The Centers for Disease Control keeps track of the flu throughout the year by 4 different ways. The first way is lab surveillance. That is where they track the number and the percentage of flu tests that are positive across the country. Another way is outpatient physician surveillance, and that is the percent of doctor's visits that people have for flu-like symptoms. Another way is mortality surveillance, which is the number of deaths caused by the flu. And lastly, hospital surveillance. It is lab-confirmed infections associated with hospitalizations. Common questions asked about the flu are, if I had the flu or the flu vaccine last year, will I have immunity this year? Not necessarily, because a person's protection or protective antibodies decreases over a year's time. Therefore, the need to get immunized each year. Another question people ask is, how quick will I get sick? After exposure, you usually will start to show signs and symptoms of the illness in 1 to 4 days. Another question that is common is, can the flu be treated? The flu can be treated by antiviral drugs such as Tamiflu and Influenza. These drugs can shorten the symptoms of the flu by 2 days. Once you start the antiviral medications, you actually have to begin them 2 days within the first symptom of the flu. Common myths that people have about the flu are, can I get the flu from the vaccine? According to Guy, you cannot get the flu from the vaccine. The flu vaccine is not a live virus. If you do get the flu post-vaccination, it's because it takes time for the immunity in your body to build up, and you have likely contracted the virus before your body had a chance to build immunity. For that reason, it is best to get vaccinated earlier. Another myth that people have is that it's better to allow your natural body immunity to fight the flu. According to Sandral, they state the body's immune for a couple of months after the illness, and you need to get vaccinated each year. So my question for you today is, have you had your flu vaccine? Thank you.